Okay, so look at this question here. Proton pump inhibitors, PPI. They have asked this for 3 marks in the recent examination. Proton pump inhibitors. So do you know what these are? If somebody says PPI, will you be able to answer? Very good. So it is name of a drug, pharmacology. It is a for treatment for peptic ulcer. Very good, guys. So now let's look at where it sits in the classification. Okay, so where are we here? In gastrointestinal drugs. That is everything about your stomach and intestine, right? In this system, they're talking about peptic ulcer. So peptic ulcer is a disease, you can say, yeah. So drugs for peptic ulcer, that is treatment for peptic ulcer. In that you have PPIs here, proton pump inhibitors. They will inhibit gastric acid secretion. They will prevent the secretion of acid in the stomach. So they have asked you PPI. They did not say examples. They did not say what they want for 3 marks. So now it is a challenge for us to write something for 3 marks. So about PPI, first of all, what are they? They are drugs for peptic ulcer, right? And they are coming under gastrointestinal system, right? And they are coming under gastric acid inhibitor. So it is a proton pump inhibitor. That is where it is sitting. What are the examples? The examples that you need to know are Omeprazole, S-Omeprazole, Pantoprazole, Rabeprazole. If you know these 4 which are commonly used, it's enough. Omeprazole, S-Omeprazole, Pantoprazole, Rabeprazole. Omeprazole is the prototype drug. S-Omeprazole is another variation. Pantoprazole can be given IV, right? Rabeprazole is a newer one. Okay. So now let us see what else we can write about proton pump inhibitors. So basically, about proton pump inhibitors, you can say that these are stopping the production of gastric acid in the last step. So if you have a, if this is a cell in your stomach which produces acid, okay, the last step is the proton pump. So this is H plus, that is acid it is producing, right? So this is produced by an enzyme called as ATPase enzyme. What is that enzyme? There is some enzyme here, okay, proton pump. This is pumping the proton. So let me write like this. This is pumping the proton, right? So this is the proton pump. This is the proton pump. I'll write here. This is the proton pump. PP I'm trying to write. Okay, this is proton pump. Now what drug you're giving? Omeprazole, S-Omeprazole, Pantoprazole, Rabeprazole. That is a proton pump inhibitor. That is the proton pump inhibitor. It is a drug. Proton pump inhibitor is going to inhibit the proton pump. So what will happen? The H plus, the acid, the proton is not able to get released. Okay, so the last step, what I'm trying to say, the last step is stopped. So what are the steps before this? Before this you have some histamine, something. So many things are there. You stop stress, you stop histamine, something like that. Lot of ways of stopping are there. But if you stop here, right, PPI, see, none of these matter because the final step you have stopped. You understood, right? So this is diagram that you will write and explain about proton pump inhibitor. So what and all you explained, examples you gave, how it works, mechanism of action also you have told. Very good. So here is that diagram from the textbook. Here you have the proton pump. You can see here the proton is getting pumped. H plus is getting pumped here. So which is that proton pump? It is H plus, K plus, ATPase. Okay, this is going to be irreversibly inhibited. So that is what you have to, it is stopping in the final step and irreversibly it is inhibiting this enzyme. Okay. So what will happen until this enzyme is made again, you will not have acid, which is very nice, right? So about 18 hours they are saying. So every 18 hours if you take a tablet, that should be enough to stop your acidity. So when it comes to these capsules if you're talking about. So this will be enteric coated tablet or capsule. It should not be powdered, remember, because it has to escape the acid of the stomach and go and get absorbed in the intestine when you're giving omeprazole. Okay, so it is the first choice for peptic ulcer, guys. What will it stop? It will stop the final step of gastric acid secretion. It is irreversibly inhibiting K plus ATPase. H plus K plus ATPase enzyme. Very good. This much you will write. Then what will you write about this? It is covalently binding with this enzyme, so it is irreversibly binding. So this enzyme has to be newly synthesized something. Okay, something like that you remember. Then I'm not going into very much details of pharmacology. Then you have S-omeprazole, very commonly prescribed because it has higher bioavailability than omeprazole. It is better for GERD, gastroesophageal reflux disease. Guys, so you understood the treatment for peptic ulcer, GERD, all that is this PPI. Okay. Next, lansoprazole, I'm not going into that. Pantoprazole, very commonly prescribed. Again, it can be even given IV. You must have seen whenever somebody comes into emergency, we give them some drugs and pantoprazole goes in also. And then, Rabeprazole, we told you it's newer. Okay, that's it. Then where and all you use this, guys, focus. They have asked only for 3 marks, but I'm telling you everything that you can write in 5 minutes, whatever you can, you write. Okay, it's used for peptic ulcer, bleeding peptic ulcer treatment, stress ulcer, GERD. We told you prevent aspirational pneumonia pre-operatively. If there is tumor, Zollinger-Ellison syndrome, also they are talking about all this PPI. Okay, see this. What is this aspiration pneumonia means? The acid from the stomach can come back, right? It reflux is happening that can enter the lungs. Okay, come to your mouth and go back to your lungs. That is aspirational pneumonia and very commonly happens if the person is under the influence of anesthesia. So pre-operatively to prevent aspiration pneumonia, they'll tell you why you should not eat before surgery and all, because they don't want aspirational pneumonia. Okay, that is for the food. But what about the acid that is getting produced? Even that should not be there in the stomach. For that, they are giving you the PPI. Okay. Now, what are the side effects of PPI? Not much, guys. Just remember, prolonged treatment can lead to atrophic gastritis. Standard side effects you can write. Okay. Mainly, you remember atrophic gastritis. Atrophic gastritis. The atrophy is happening of the stomach, is it? Okay. Okay. But anyways, we are commonly prescribing it to people, right? So that is why they are asking you in the exam. Okay. So if you can't give PPI for whatever reason, what else can you give, guys? Have you seen them giving ranitidine? I have seen people being given ranitidine. Okay, very commonly Rantac we give. Sodium, see aluminum hydroxide, all this aluminum hydroxide, all that in that cremafin syrup and all, you will get all this very commonly, right? This one, colloidal bismuth subcitrate, all the sucralfate, all these are also commonly used, okay, in those syrups especially. Then if the acidity is also triggered by the bacteria in the stomach, that is because of the H. pylori bacteria, then you will give anti-H. pylori treatment. Definitely you would have heard of azithromycin, clarithromycin, metronidazole, tinidazole, tetracycline, and CBS is what? This colloidal bismuth sulfate. Okay, sorry, so colloidal bismuth subcitrate. So other things also we have told you which are there in this classification. Okay, competitors for your PPI. That's all, guys. Hope you will get 3 marks. Bye bye.